Hi folks, Mike here. Thanks for tuning in. I have my paper because I've got questions from different sources, so I have to put them all in one place. I have a number of them. I can't answer all of them, but I'll start rattling off a few. One, when is it too young to get first shots? And first shots are administered probably second day of birth, so right away, mostly for protection against hepatitis B, which is another story. And is another question. So I'll move on to the next question. Do you feel that babies get too many vaccines at once? No, I don't. I don't feel anything, emotionally. It shouldn't be about my feeling. It's about science and medicine and the history of vaccination. Vaccinating children and adults prevents disease. That's been scientifically proven, so I agree with that and encourage that. I'm in college. Can I still keep coming to you? Yes. There's like a transition from college. So when you start going to college, you're welcome to still come to us with the idea, though, that you're going to transition to adult doctor. So by the time you're 20, 21, you should be getting a new doctor, even though we'll miss you. It's time to get an adult doctor or health practitioner. Next question. Can I breastfeed and drink wine? I don't know. Can you? You just have the baby in the one arm, the glass in the other, so it should be possible. Oh, okay. So it's not really can I, it's should I. So I guess this is your reservation about alcohol. Is will the alcohol affect the baby? So that's a good question. So first, you should know that alcohol in the blood is that level of alcohol in your blood will be similar to the level of alcohol in your breast milk. So as a general rule, if you feel the alcohol, then you're expelling the alcohol in your breast milk to the baby. So your baby will get it. And the next question is, so the baby gets a little alcohol. Is that going to hurt him? Well, there have been some studies that show that alcohol disrupts the active sleep cycle of the infant, which is important for development of the brain as well as growth. And also, there have been some studies that show that with exposure to alcohol and breast milk, that these kids have a delay in motor development in their early years of life. So there is some effect. So the correct medical advice for me to say is you shouldn't drink when you're pregnant and you shouldn't drink when you're breastfeeding. That's the correct advice. So then, but some moms will come in and say, okay, Mike, I'm not going to expose my child to alcohol, so I've stopped breastfeeding because I really want to have a drink now. I haven't had any wine for 9 months of pregnancy, and then I've been nursing for 4 to 6 months, and now I just want to have a glass of wine. I don't want to expose my child or my infant anymore, so I'm going to stop breastfeeding. I don't know if that's, I understand the point, but I don't know if that's the answer. The other thing is, the other argument I'll hear is, well, moms in other countries drink wine when they're pregnant, and they drink wine when they're breastfeeding, and wine's supposed to increase your breast milk production, so I'm going to continue to do it. It just makes sense. So that is true that they do it in other countries. It's not necessarily scientifically proven that alcohol increases breast milk production. It may relax you and allow you to nurse in a more relaxed fashion, but the alcohol itself doesn't necessarily increase lactation. In fact, it may decrease it. Now, what's the reasonable answer? Because then some moms are just not going to tell anybody and just do it anyway. The logistics of alcohol are, if you take a glass of wine and you drink it, it takes about half an hour to kick in, half an hour to an hour. So if you're tipsy, because women get tipsy, they don't get drunk, they just get tipsy or buzzed. They don't get drunk, apparently. That's the words that are used. Then you will have alcohol in your breast milk and feed your baby, then you're giving the alcohol to your baby. But about 2 to 3 hours later, you will have a metabolizer broken down that wine. It shouldn't be in your system anymore. So if you said, well, I'm just going to go out to dinner. I just breastfed my baby. I'm going to go out to dinner now, or I'm going to have dinner at home. I'm going to have a glass of wine, and I'm going to relax. I'm going to take a little nap, or I won't nurse again for another 2-3 hours. Then it sounds reasonable. But if you drink to the point that you're tipsy and you're affected, and it's time for your baby to nurse, then you probably should just pump it and throw it out. And then use some saved breast milk from earlier in the day, or some frozen breast milk, or supplement. So there's a lot of variations on what you can do, but sometimes you just have to be reasonable and protect your baby, but also enjoy your life. That's it for this week. Thanks very much, and I hope you have a great week. Bye-bye.